My name is John Greco. I'm from Greenwich, Connecticut. Back in 2015, I was at a routine physical, and it was only through mentioning that when I cycle or run long distance, I get a bit of core fatigue in my abdomen. He recommended that I have an ultrasound. It was that ultrasound that revealed the fact that I had significant aneurysms that needed to be operated on as soon as possible. I'm an active person. I do a lot of triathlons, which involves cycling long distance, running long distance. And one of the doctors who evaluated my circumstances, he said that I would probably never run or cycle long distance again.
For someone with John's diagnosis, which was an abdominal aortic aneurysm with bilateral common iliac aneurysms, there were several treatment options. We could do a traditional open repair, which would require an incision in the abdomen, and we'd replace the segment with a prosthetic graft that would sew in place. We could have used a conventional endograft where we would have relined the aorta, but we would probably have had to embolize the internal iliac arteries if we wanted to do it entirely endovascularly.
The last option was participating in a study. And it was really the study that gave me a solution that enabled me to actually have full blood flow to my lower extremities.
Ultimately, one of the things that was available to us as part of this clinical trial was the Gore EXCLUDER iliac branch endoprosthesis. At the time, it was investigational, but it was a device that was specifically designed to treat aneurysms involving the common iliac artery and extending to the bifurcation. And so it was a purpose-built device for this anatomy.
Coming to you, I was looking for a solution that would enable me to be able to go back to being physically active. I didn't just want to be alive. I wanted to be able to resume my lifestyle and do all the things that Melissa and I love to do together, traveling, cycling, running, participating in races. So this study by Gore was what was the game changer for me.
You know, there are always concerns when you enroll someone in a device trial. You go in thinking that it's a good solution for the patient, but you know that it's still being investigated. And so you're in a little bit of uncharted territory. And you are younger than 98% of my other patients. And so we wanted to make sure that we had a durable repair. In hindsight, it's easy to talk about durability. We've seen the repair has been durable in your case, and we've got imaging to show that. I think one of the benefits was that although this was new technology in terms of the location of its application, there's actually a pretty long track record with this device technology in the abdominal aorta. And so I had some confidence that the results would be good with this device based on that.
I love cycling. I love running long distance. I love seeing how far I can go. I love training for them, setting a date on a calendar, and just working toward that date.
The decision to pursue this technology really, it should be individualized, and you have to factor in the patient's functional level, and their desires, and their anatomic considerations as to whether it's appropriate or not.
Melissa and I continue to do races. We've done probably about, since the surgery, 40 triathlons, and some of those were qualifying races for participating on Team USA. But, I've not run out of challenges.